No, this is amazing, and I think Kelly and Ada have really set the stage and given us a foundation of principles to think about, and how to, what the barriers to behavior change are, and I love the hypotheses on how to start moving us there. So now, as Ada alluded to, what are some real world examples of success or how this has happened? And we can get right into it, actually. So Julie, first question for you is, if you could talk a little bit about how WW is applying behavioral sciences today, to drive healthy actions among its members. And also, I was so intrigued when we spoke about how you brought together kind of behavioral scientists and design, or designers to fuel better outcomes. So if you could just talk a little bit about your efforts at WW, that would be a great way to kind of kick us off.
Yeah, so I think there's kind of two ways that we think about it. So one is in terms of our core product and making sure that our program actually helps people build habits in terms of, fluency and not overthinking things. And then the second piece is sort of like, how do you then design the experience to really reinforce those habits in a long-term way so that it's not just like a one-off set it and forget it, but like a continuous interaction that kind of evolves with the user, over time.
Amazing, great. Um, something, Reena, we talked a little bit about, you're obviously able to is at the forefront of kind of reshaping mental health and well-being. I'd be so curious, what are some of the opportunities or challenges you anticipate in virtual mental health and well-being moving forward?
Yeah, it's such a great question, John. Yeah, for those of folks that are listening in that don't know what we do at Able To, we're a virtual provider of mental health care. And we've been at it for about 10 years when people weren't even thinking about telehealth and certainly weren't applying telehealth to mental health, and trying to get patients to change their behavior, and focused really at the outset on those individuals who had coexistent physical health conditions. You heard from John that I'm a cardiologist. You might be scratching your heads as to what got me over to mental health, but found it really difficult to help my patients change behavior in the clinical setting, and really came to understand to the degree to which mental health barriers were really in the way, and without addressing depression or anxiety head on, it was really challenging for me as a clinician to really help my patients adhere to their meds, quit smoking, exercise, eat right, whatever it may be. And that's the kind of work we do now much more broadly. But I mean, John, you're asking about what opportunities and what challenges still exist in our space. I mean, the opportunity, just to start there, I mean, what's wonderful is that mental health is getting an intense focus these days. And short of mental health, emotional health and emotional well-being. It preceded COVID with a lot of celebrities and actors and actresses and many others increasing awareness about mental health. COVID shed further light on the impact that mental health was no doubt going to have. So it's been great. But that explosion of interest has led to a lot of confusion in the space. So I feel like we need to apply behavioral economics to buyers and decision makers, and how they think about which solutions to select. I think the challenge that remains, though, is while the focus has been on access and getting people to start to utilize tools, I think there has to continue to be a focus on quality and proof and outcomes. So I think there's still a ton of opportunity to improve virtual mental health care in those regards.